Hi, my name is Olivia Niemi, and for the favorite brain project, I picked the cerebellum as my favorite part of the brain, and I will explain why in a little bit. So, what is the cerebellum? The cerebellum is located behind the brainstem, right down there, that little yellowish, like nut-shaped looking thing. It controls movement. Really, the frontal lobe controls movement, but the cerebellum fine-tunes this movement. And so it's involved in all types of movement in the body that we use on a daily basis, and that how we function. So this area of the brain, the cerebellum, is responsible for fine motor movement, which is what I'm really focused on here. Balance, and the brain's ability to determine limb position. So where you're being able to determine what parts of your body are where and how they're moving, etc. And for some people with disabilities, that's a really hard thing to know where their body is and how it's moving. So why I chose the cerebellum. The cerebellum is the part of the brain that controls fine motor skills, and I'm going in occupational therapy. I'm starting the occupational therapy program at Xavier in the fall, and a huge part of what OTs do, which is really mostly fine motor skills and fine motor control, is a part of everything that OTs do pretty much. And so they work heavily on improving those fine motor skills, fine motor control. And I also work as a caregiver for a girl with a disability that she struggles a lot with fine motor skills. She's in high school, but she can't write, tie her shoe, even like putting stickers down, brushing her teeth, like taking a shower, any of those things, buttoning her pants, all of those things are really hard for her because she doesn't have the fine motor skills and fine motor control to do those daily functions that we take for granted every day. So the cerebellum is really interesting to me because that is what kind of controls all of these things. So, what are fine motor skills? I kind of talked about it a little bit, but it's small movements of the hands, wrists, fingers, feet, toes, lips, and tongue. So, any skills that are necessary to perform everyday tasks. So, whether that's brushing your teeth, even like making your bed, cooking, using a fork, like that's fine motor skills. Typing, writing, tying your shoe, doing beads like in this picture, any like little movements are all fine motor skills. And so for some people that have developmental disabilities or a lot of people that have had strokes a lot of people can't use a fork anymore. They can't, they've lost function in those fine motor skills. Going to the bathroom, brushing your teeth, all of those things are really hard when you lose fine motor control. So they're necessary for everyday tasks, for play. Little kids, building those fine motor skills when they're little is really important, and OTs work with children on developing those fine motor skills early. Self-care skills, like I said, personal hygiene things like brushing your hair, brushing your teeth, buttoning your clothes, all of those things are things that we don't even think about but are really hard for some people. And then some examples of the play skills I talked about. Cutting with scissors is big. Coloring, the girl I work with, coloring is really hard for her. Painting, beads, putting little pieces together, puzzles are really hard. So all of those things, working on those build your fine motor skills. Some of the self-care things, buttoning t-shirts, tying your shoes is big, using a knife and fork, all those daily tasks that we use. So some functions of the cerebellum are maintaining balance. The cerebellum has these special sensors that detects shifts in balance and movement, so you can control, if you feel like you're about to fall, the cerebellum helps you correct that and whatnot. Coordinating movement. Most body movements require coordination of multiple muscle groups. Also vision, the cerebellum coordinates eye movements. I'll work with a lot of vision patients, I'm sure. I've already seen that while working in the hospital. People that have lost their vision come to an OT. Motor learning is huge. The cerebellum helps the body learn those movements, and which those movements require practice and that fine-tuning. Some other functions are thinking. Cerebellum has a role in thinking, language, and mood. So some of the disorders related to the cerebellum are stroke, brain bleeds, toxins, genetic abnormalities, and infection and cancer. Ataxia is a main symptom of cerebellum dysfunction. Ataxia is a loss of muscle coordination and control. So sometimes kids are diagnosed with this when they're young. They just lose control of their muscles, and so sometimes they might fall over, they might have blurry vision, they might have difficulty swallowing, they might be tired a lot, or just like making precise movements with your muscles can be really hard. So to sum it up, the cerebellum is a part of the brain that plays a vital role in virtually all physical movement. The cerebellum helps a person drive, helps a person throw a ball, or even walking across the room. But it can also assist people with eye movement and vision, and some problems with the cerebellum mostly involve movement and coordination difficulties, since that is what the cerebellum mostly controls. And then these are my references, and that's all I have. Thank you.